राम राम लाड। Privileged to introduce our esteemed guest speaker, Dr. Ulas GP, BAMS, Shirley Center, a dedicated Ayurvedic practitioner and surgical expert with valuable clinical and academic expertise. Dr. Ulas GP is currently serving as a consultant and MS at Sri Raghavendra Ayurvedic Hospital, Madhukiri Town, Tumkur District. His expertise in Shalyatantra and practical approach towards Ayurvedic surgery and parasurgical management have greatly contributed to patient care and the advancement of Ayurveda. Today's session on importance of surgery and parasurgical procedures in Ayurveda promises to provide deep insight into the significance of surgical principles and parasurgical techniques described in Ayurveda and their relevance in present-day clinical practice. We are truly grateful to have such a knowledgeable speaker with us today. Without further delay, I respectfully invite Dr. Ulas GP to begin the session.
Good evening, everyone. Is it audible?
Yes, sir.
Okay. Myself, Dr. Ullas GP. Today, I am going to explain about the importance of surgery and parasurgical procedures in Ayurveda. Everyone knows about the importance of surgery in allopathy and modern practices, and what are the parasurgical procedures we can do in Ayurveda, and what are the cases we are doing nowadays in the OPD basis and practice and all. Now I'm not going to explain about deeply. Just I'm going to give a into practice parasurgical procedures in OPD basis. So coming to the before going to the parasurgical procedures, some common surgical procedures in Ayurveda. That procedure's name, one is everyone knows that is called Ashtavida Shastra Karmas. One is Chedana, Vedana, Lekana, Vedana, Eshana, Aharana, Vistravana, and Sivana Karma. These are the common procedures we can practice every day in clinical practice. What are the surgical diseases we are seeing in Ayurveda? One is Bagandhara, it means fistula in Nenu, Harshas, Nadivrana, Vidradi. Everyone, all can see the screen.
No, sir.
1 minute. Now all can see the PPT.
Yes, sir.
Okay, these are the surgical diseases in Ayurveda. Everyone can see the. Hello, is it audible?
Yes, sir.
Okay.
Yes, sir.
So, the common surgical procedures we are practicing nowadays in Ayurveda. One is Bagandhara, that is fistula in hemorrhoids, Arshas, it means Arshas, Nadirona, it is commonly we can see pilonidal sinus cases, and Vidradi, Arbuda, Ashmari, and Mutragata. See, and parasurgical procedures, what we can practice in OPD basis, one is Kshara Agnikarma, Raktamokshana, and Charasutra. These are the parasurgical procedures we can easily practice in OPD basis, and it will be very beneficial for the patient also for in money wise also for everything. And in coming to the one by we'll discuss one by one. Coming to the Ksharakharma. In Ksharakharma, in what and all the diseases it is indicated is one is Arshas, Bagandhara, warts, pylonidal sinus, and non-healing ulcers like Dushtavrana. We can call it as Dushtavrana. In that conditions, we can use Ksharakharma. This this
Yes,
is the
sir.
this is the first case. This is the one case of pylonodal sinus. After excision, we can this in first figure we can observe that we have done the excision of the sinus tract. After the excision of sinus tract, we have in second picture we can see that we applied the Ksharakharma. Okay, that is Tikshna Kshara. And in third picture, we can observe that after Tikshna Kshara application, we have done washed with the Nimbus Varasa and normal saline. After 1 week, you can observe the granulation tissue over the wound. This is the second case of internal hemorrhoids of grade 2 or grade 3 internal hemorrhoid. In first picture, we can see the pile mass internal at 11 o'clock, and we have applied for that Sharakarma, that is Apamarga Tikshna Kshara, and we can observe the cauterization of the what are the changes we can see in the third picture of Sharakarma. Everyone knows about the Kshara Sutra. In Kshara Sutra, this is the Kshara Sutra cabinet what we have, what it is present in our hospital. What are the advantages of Kshara Sutra cabinet? Usually to prevent atmospheric dust particles from the sorry. What are the advantages of Shara Sutra cabinet? The advantages of Shara Sutra cabinet to prevent the atmospheric dust particles from sticking over the wet threads, and it also it dries to coated thread. That is what we have wrapped in the. We can observe the in pictures in Akshara Sutra cabinet pictures. We can observe that, and it also it will avoid to the avoid for the contamination. The main and also the main aim is to maintain the sterilization through the ultraviolet rays. That's why we will put after coating of Shara Sutra cabinet. Anybody knows about the Shara Sutra cabinet? Shara, how many coatings we have done in the Shara Sutra? Anybody?
Total 21 coatings.
Yeah. This is the Kshara Sutra hanger. what we have in our hospital. And this is the Kshara Sutra, quoted Kshara Sutra of 21 quoted Kshara Sutra. In that only we have prepared Kshara Varti also. In Bruduk Kshara we can prepare Kshara Varti also. See, this is the third case. We can observe that there is a small 1 to 2 centimeter track over the in 12 o'clock position. We have taken probing. We have done probing from 12 o'clock to 12 o'clock, and we have done Kshara Sutra here. This is the second case, and we can observe that this is a pilonidal sinus tract. Uh, First figure we can see the external opening coinciding with the natal cleft. It is excised under the local anesthesia, and embedded air follicles were also removed. In second figure, we can see the ligation of Kshara Sutra in underlying the tract, that is sinus. And second, in third figure, we can observe that we have changed the Kshara Sutra. And fourth figure, we can observe that totally, completely healed sinus of the tract. Then coming to the Sharaplota, everyone, it is the new name Sharaplota. How it will be prepared Sharaplota? We can use this Sharaplota. Reference is in Sushruta Chikitsasana first chapter in 40th sloka. Sushruta has mentioned that Sharaplota, Plota, Vikeshika, and Kavalika. All these medicines we can use it in Dushtavrana. So how Kshaраplota preparation will be done, in Kshara Sutra, how we are doing the coating, na? Same way Kshaраplota preparation will be done. The total in Kshara Sutra will do 21 of coating, but in Plota we will do only 3 coatings. One first coating with the Snuik Shira, and after 24 hours, next coating with Snuik Shira along with Apamarga Kshara, then third coating Snuik Shira along with Haridra Churna. So this is the Kshara Plota. We can see the Kshara Plota, how it will be in 10 into 10 centimeter of gauze piece we have prepared, and the measurement of the wound will take the measurement of the wound, and we have applied the Kshara Plota. In case 1, we can see this is a case of venous ulcer. First, on initial day, the slough was present. On second day, we have applied a Kshaраplota in during the procedure of the Kshaраplota. After 12 hours, we got the granulation tissue. Why Kshaраplota? In modern surgeons, what and all they are doing for Kshaраplota, for wound debridement, they are using boric acid and and they are doing the debridement and all. But in Ayurveda, we have lot of medications for debridement. Like way Kshaраplota is one of the medication for debriding the wound. We can observe the second picture also. In this is the case too. We can observe that applying Kshaраplota, all the slough particle was present in during the procedure of the stop Kshaраplota. In second case, we have stopped, right?
Right, sir.
Okay. This is the second case. We can see the importance of Kshaраplota. In modern surgeons and all, they are doing for the debridement and all. They are doing the debridement, and they are with the help of instrument they are doing debridement, and other chemicals they are using like boric acid, or it means usol, and other hydrogen peroxide and betadine they are using for the debridement. But in Ayurveda, we can see many. Sushruta has mentioned so many uh, medicines for the debridement of the wound. For example, this is Sharaplota is one of the example. In third case, we can see this is the case of dermatofibrosarcoma. This is a case of Arbuda. See, in first case, this is the 64-year-old male patient. In 2008, he underwent for surgery of the excision of the that arbuda in 2008. Again, the reoccurrence of that arbuda in 2016 he has seen again. So 2019, after in 2016 also he underwent for the surgery. In that surgery, the histopathology report and the biopsy report has come as is dermatofibrosarcoma. It is a case of skin cancer actually. So after in 2019 again he come to our hospital with the same complaints. And when I saw that this case first time, we have see the huge swelling around the uh, huge swelling in the axillary region and blackish discoloration over the scapular region. So for that I have applied Ksaraplota and Ksaraplota. For that cyst I have tied with the Kshara Sutra. That cyst has cut down after 1 week. We can observe that after applying of Sharaprota, we can observe the granulation tissue after 24 hours. Everyone can saw that 24 after granulation tissue, and the cyst was cut down after the cut through after one week. Then coming to the Agni Karma, in Agni Karma, we can do this Agni Karma procedure in OPD basis only for musculoskeletal pain, for corn excision or sciatica in Grudrasi cases and tendonitis cases and chronic ulcer cases. For example, patient come with a corn excision. Many of the patient in my OPD, I have seen that there is a reoccurrence of the corn. It means kadara. There is a reoccurrence of kadara because of excision. After we do the cauterization, that is Agni Karma, with 90% chances of recurrence will be very less. In sciatica also, patient may complaints of only pain over the lower back radiating to right or left side of the limb. So in that condition, we can go for Agni Karma, that is Bindu Agni Karma at the pain site. Patient may relieve 80% of the pain. This is the case of one patient has came with the severe pain in the elbow region. So we have done Agni Karma with the Panchaloa Shalaka. So patient after 2 days, patient has got relief from the pain. 90% of the pain has relief after 2 days. So this is like, so we can practice Agni Karma in OPD basis only. Now these are all the procedures we are doing in our hospital. And coming to the Rakta Mokshana, there is a type of Rakta Mokshanas. According to Sushruta, Rakta Mokshana is the Ardha Chikitsa. Bloodletting therapy is an Ardha Chikitsa. It means bloodletting therapy for removal of the vitiated blood. How Kaya Chikitsa, according to Kaya Chikitsa, Basti, according to Charaka, in Kaya Chikitsa, Basti is Ardha Chikitsa. Like that, in Shalya, Rakta Mokshana is the Ardha Chikitsa. These are the types of Rakta Mokshan. One is Siravedana, Prachana, Shunga, Jaloka, Alabo, and Gatiendra. See, in Siravedana, in varicose veins and all the condition, we will do the Siravedana. This is the procedure of Siravedana. Everyone knows, I think. In varicose vein, and when patient is having Ardhava Bedaka like Shiro, severe headache, in that condition also we can do the Siravedana. In other condition like in goiter condition, in Galaganda condition, in Galaganda disease, in Siravedana we can do in the uh, jugular vein. We can draw this jugular vein, drain the jugular from the jugular vein. How much ml of blood we have to drain from the while doing Siravedana is, according to Acharyas, there is 760 ml. We have 760 ml. We have to drain the blood according to Acharyas, but in clinical practice we are draining only 100 to 150 ml of blood. If we draw 750 or 760 ml of blood, patient may go for a severe patient may go for the fatigue. That's why we'll draw only 100 to 150 ml of blood. This is the case of this is the case we can observe that Prachana Karma I have done. And coming to the Jaloka Charana, this is the case study. One case we have done. We can first picture. We can observe that patient has got lacerated wound or the inflammation over the face. For inflammation over the face and all, instead of going for the anti-inflammatory drugs or NSAIDs, in day 3 only we can observe the reducedness of complete heal of the wound. This is the second case. This is a case study of second case. We can observe that there is a lacerated wound over the hand. Patient came to our OPD. We have done Sivana Karma suturing, and after second day, we have observed that blackish and hematoma over the hematoma and exudates over the hand. For that, we have done Jaloka Charana. After that, went for the post skin. We can observe the post skin graft status after Jaloka Charana. This is the case of thrombosed hemorrhoid. For thrombosed hemorrhoid in modern surgery, they will go for the surgery in hemorrhoidectomy. But we can, for thrombosed hemorrhoid, we can do Jalokacharana. What will do this Jalokacharana? It will reduce the inflammation of the that thrombosis, and it will suck the blood and it will reduce the thrombosis. This is the case of fourth. We can see four layer of in facial. There will be four layer muscles layer will come. For that, he has got lacerated injury. We have done suturing inside and outside also. For the inflammation of the that suture, we have done Jaloka Charana for total of 5 to 7 sitting. After 5 to 7 sitting, patient got complete inflammation, and what he was getting a pain, everything has reduced. What are the importance of this Jaloka is? One is it will help, it will do anticoagulant, vasodilation, and platelet aggregation inhibition, and it also done clot dissolving, and it also work as I already told this, anti-inflammatory and analgesics. By all, what is the importance of all these is, one is it reduces pain, edema, and it significantly, and it removes inflammatory exudates and also hematoma, and it decreases the venous pressure, and it improves circulation, and it eliminates the toxins, that means visha, and it stimulates the cell proliferation, and it reduces subconjunctival hemorrhage. These are the procedures, common four procedures we can practice in OPD basis. Thank you.
Thank you so much, sir. As we come to the end of this insightful session, I'd like to express my heartfelt gratitude on the behalf of our sons educators. If anyone has any question, they can raise their hand and we'll take up the questions. Does anyone of you have any questions?
Hello, sir.
See, yeah,
Yes,
one thing. Yes. Yes, many doubts.
yes, sir. I have. It can be said there is a doubt, but I have
Ah,
a case of hidradenitis suppurativa, right? A
okay.
skin disorder in which
Ah,
sinuses and tracts are made.
okay.
Yeah, and there is a heavy suppression, matlab
Oh,
pus discharge from those sinuses.
hmm,
Majorly it occurs in the area of groin region,
hmm.
underarms, and the chest area region where the nipples are visible, right? At that
Yes.
area. Yes.
Yeah.
So these are the major locations of that disorder,
Hmm,
and I've gone through a lot of researches. And why
hmm.
I have joined this lecture was just that because of that case only. And I'm a practitioner. I
Okay.
just started practice right after my BAMS with
Okay.
no MD or MS.
Okay.
So yeah, that case I had. So I had gone through a lot of researches. They say about Shar Sutra
Hmm,
type in the
hmm.
sinuses. So
Hmm.
what's this process and how can this case be laid throughout?
Okay, see, Kshara Sutra, you are a BMS student, right?
Yes, sir. I am BMS student.
Okay, this Kshara Sutra, it is having all we will quote with the medicated drugs. So it is having all Chedana property,
Hmm.
Ropana property, and Vedana
Hmm.
property. So
Hmm.
for that sinus, we have to put a Kshara Sutra. What it will do? It will drain the pus. What collection will happen? It will drain the pus, and it will helpful for the healing purpose. That's why in these cases and all, we will advise to put Kshara Sutra instead of going for the excision. If you go for excision or any open wound, there will be again reoccurrence of the wound or any again reoccurrence of the collection of the pus. That's why we'll put a Kshara Sutra for draining the pus.
So what's the process? Like in each, suppose we are doing the Shara Sutra today, right?
Yeah.
Then after it will get dried out. Only then we have to remove after that by
No, no,
cutting
no,
off.
no,
Then
no,
what's the process? Yes, sir. I
no,
want to know that.
no, not like that. See,
Hmm.
for if any for patient will come for a patient will come with the OPD with the complaints of that sinus tract and collection, okay, in axillary region, for example.
Yeah, sir.
Okay, in
Yeah,
that
that's
condition, we have to do the probing from the external opening side, and we have to look for the track where it is going.
okay. So, but
Okay,
in that disorder, the tracks are interconnected, right?
ah, yeah,
Huh.
interconnected. So
Okay.
where straight if direct connection is there, so we have to go for the direct connection of the
Hmm.
track, and we have to put the first we have to put the primary thread.
Okay.
Why we have to put primary thread? Because Kshara is having all the properties. So
Hmm.
patient will get more irritation and pain on the same day. If you put on the same day, patient will get
Hmm.
more pain and irritation. That's why we have to
Hmm.
put plain thread after next day or third day. We have to
Hmm.
change to Kshara Sutra. Okay,
Okay.
every week we have to change the Kshara Sutra till it cut through by itself.
Okay. Okay. So this procedure, have you have in your records or like in a video form
Yeah,
so that
that actually I have done that case but I have not recorded that photos and all.
so how was
In
the
my PG
results?
in my PG practice, I have done that case. So I lost that all recordings. So if I got, I will send you.
So definitely, I'll get connect to you personally.
Yeah.
Uh, yeah. And so, what are the duration of that relief?
Depend, that duration it will be depend on track. For example, if it is only 2 centimeter of track, it will take
Hmm.
5 to 6 weeks.
Okay, right.
Yeah.
Okay, right. With
Everything.
internal medications as well.
Internal medication we can give Nimbadi Gugulu
Hmm.
in Ayurveda, Nimbadi Gugulu and
Hmm.
Arakvadadi Kashaya. Only two
Okay.
medicine is enough.
Okay. So durations of medications should be up to 5 to 6 weeks continuously with the
Yes.
ligation of
Yeah, after
yeah.
cut through also we can continue the medications.
Okay, Nimbadi Guglu with the Aragvadadi Kashayam.
Yeah,
Right.
it will. Yeah. Thank you.
Okay, okay. Okay, sir. Thank you.
Any more questions? You can raise hands or directly unmute.
See one thing, what everyone, all BMS our students are doing, they are blindly they are trusting allopathic medicines, and nowadays also they are practicing. But what I suggest is we are having good opportunity, and we are having good our own medicines to give to patients and to practice, and we have some parasurgical procedures like this. And this Sharaplota, it is my PG dissertation topic. I got good results in this. So if anybody wants to do practice, they can go for this. Not only Kshara Plota, can go for Kshara Sutra also. Kshara Sutra in Dusharana cases also, if any sinus track is developed in that condition also, we can put a Kshara Sutra for on the wound Dusharana. In that it will helpful for the wound healing early. And for example, we can see many patients with complaints of case of diagnosed with PVD, peripheral vascular diseases. In that condition, in allopathy doctors, what they will suggest, they will tell patients to go for amputation. In that condition, we can go for Jalavka of 5 to 7 sitting of Jalavka. It will improve the blood circulation. Along with that, we can go for the Basti Chikitsa, that is Manjishtadik Shara Basti Chikitsa. It will helpful for the healing. I suggest in this condition they can practice these medications. Any doubts?
I guess there are no more doubts. So, first and foremost, I sincerely thank our esteemed speaker, Dr. Ulas GP, for sharing his valuable knowledge and experience on the topic importance of surgery and parasurgical procedures in Ayurveda. Your enlightening presentation has helped us better understand the importance and practical relevance of surgical and parasurgical procedures in Ayurveda. We truly appreciate the time and effort you dedicated to this session. I would also like to thank all our participants for your enthusiastic presence, attentive listening, and active participation, which made this session successful and interactive. A special
Thank you.
thanks to the organizing team of IRS and Educare for their continuous efforts in arranging such meaningful academic sessions. We hope to have many more such enriching interactions in the future with you, sir, as well.
Thank
Thank you
you
so
everyone.
much.
Yes, thank you.
Thank
Thank
you.
you everyone.